Good afternoon, everyone. Am I audible to you all?
Yes, you are audible.
Yeah, okay. So, welcome you all to the celebration of National Nutrition Month by the FSTN Exploration Foundation in collaboration with IIFST. And though this is the last day of National Nutrition Month, but I think in everyday lives, nutrition is the utmost important thing, and without which we are not able to live properly. So that's why we cannot just celebrate in one day or in 1 month. We have to just celebrate it in every day of our life. But still, we have just 1 month to celebrate the National Nutrition Month, just like we have only 5 days to celebrate Durga Puja. Just like that, we have only 1 month to celebrate National Nutrition Month, or we can call it the Rashtriya Poshan Ma, 1 to 13th September. And on the very last day of the month of September, that is on the last day of National Nutrition Month, we have come to celebrate our program, our National Nutrition Month celebration, with the help of the IIFST by FSTN Exploration Foundation. So, before going to the further advancement of this program, I just want to share something to you all, because there are very new students who are first joining any session of FSTN Exploration Foundation, and there are also very old students who are joining with us for last 1 year, but there are very new students, those who are with us just in this program. So that's why for them, I just want to share that what do you mean by FSTN Exploration Foundation? Okay, I just want to share with you all. So,
একটু একটু ঈশানী ম্যাম,
yeah,
হ্যাঁ একটু শব্দ হচ্ছে, কাইন্ডলি ফ্যান যদি থাকে একটু অফ করবেন।
okay. Just a second. I think it's audible now, sir.
Yes, yes, yes.
Okay. Welcome you all to the FSTN Exploration Foundation, and it was been established in 2019, and the main vision of the society is to arrange various seminar, workshop, webinar like this, organize various skill development program, and the ultimate vision of the FSTN Exploration Foundation is to provide the appropriate knowledge about health and nutrition, which will help to enrich our optimum well-being. So we have now running 6 courses, and for them, the most popular course of our FSTN Exploration Foundation is a 3-month virtual dietitian internship program, and they are done by various students, professionals, those who are not able to go for the physical internship. For them, this virtual internship program has been organized by FSTN Exploration Foundation. This is the most popular program of our organization. Coming to the next one, that is, we have the Certified Diabetes Educator program for 10 months, and now the 6 months is running for that program, and we have about more than 40 students in this program. Along with that, this is the 6 months Certified Renal Dietitian program organized by FSTN Exploration Foundation, and the first batch are going on. They are just in the end of their session, and the second batches have been already started from the month of August. And this is also very innovative course organized by FSTN Exploration Foundation, that is a certified sports nutritionist course for 10 months. It is also going on. Along with that, a very new course, certified course on advanced diet plan making program. It is also going on, and this is July to December session is going on now. And another new course on certified pediatric nutritionist course is also going on, and only 6 classes have been taken of these courses. So all the courses are going on now, and a lot of new courses are coming in our coming future from the month of November. A special course on pediatric nutrition will be started from the month of November. And those who want to know about all our courses, please join our official WhatsApp group, FSTN Exploration Foundation, for further informations and further details of this course. So why you do all this course here? Because this is a ISO certified organization as well as NGO Darpan certified or Niti Aayog certified organization, FSTN Exploration Foundation. So the main pillar of this FSTN Exploration Foundation, where we can say the founder and CEO of the FSTN Exploration Foundation, Dr. Shobik Tiwari. Along with that, Professor Dr. John Dewitt, who is the president of FSTN Exploration Foundation. Dr. Bipasha Dewitt, who is the main chief editor of FSTN Exploration Foundation. Dr. Swati Nakal, Director of FSTN Exploration Foundation, as well as Dr. Ranajit Kumar Khalua, Director of FSTN Exploration Foundation. And just want to say that this me, Mrs. Sushani Ganguly, Academic Coordinator of FSTN Exploration Foundation, as well as the main trainer. And along with that, his picture is not in the PPT, but he is the also backbone for the maintenance of all these groups. That is Karan Mahapatra. He is the technical manager of FSTN Exploration Foundation. And these are some of our classes. A lot of students are joining, some glimpses of our classes. And just want to say that another thing, the lifetime membership, FSTN lifetime membership. And if you want to know a lot of things about that, so please contact with the given number. And a lot of students, a lot of professionals have taken the FSTN lifetime membership. So just want to say, be with us, be with FSTN always. Thank you so much everyone for giving me this time to share my organization, our FSTN Exploration Foundation to you all, to present that because you have just seen these things in the Facebook or WhatsApp or Instagram, but you should know that where you have come. So for that, I have given a short brief about the FSTN Exploration Foundation, what we do, what are the pillars of FSTN, and why should you join FSTN. So let's not just waste much more time, because today we have gathered here for the celebration of National Nutrition Month, and in this celebration we are very, very thankful that we have along with us an international speaker, Dr. Rejina Afrin. I think ma'am has joined us.
Yeah, hello, Ms. Ishani Ganguly.
Yeah, yes ma'am. So we are very, very thankful to ma'am that ma'am has given our precious time to us and has agreed to give our beautiful speech on this occasion of National Nutrition Month celebrated by the FSTN Exploration Foundation. And after that, the ma'am have also very kind to accept our request for judging the competition on 5 in 5 competition, which are being organized by FSTN Exploration Foundation, and ma'am will be the only judge for that competition. And this is a very kind of ma'am, and we are very much thankful to ma'am. So before going to ma'am, I just want to share a brief intro about ma'am, because basically a lot of people know Dr. Rejina Afrin. She is a very popular name in the field of food and nutrition. So she is now currently working as an associate professor in the Department of Pharmacy of East West University, Dhaka, Bangladesh. She had done her degrees from the University of Rajshahi, Bangladesh, as well as she has completed her PhD in the Pharmaceutical Sciences from the Department of Clinical Pharmacology of Niigata University, Japan. And she has also received various scholarships from the Japan. She has been also a gold medalist, as well as she has done a lot of things in research. She has a vast knowledge on the research, as well as she has been awarded for the Best Poster Award at the 5th Year of Scientists Congress on 2022. as well as she is serving as a reviewer of various journal, and she is also working on various bioactive natural products. She is basically adjoining with the teaching profession as well as the research profession simultaneously. And today we are very, very thankful and blessed to have ma'am in our platform. Ma'am, the dais is all yours.
Thank you, Ms. Ishani, for your kind introduction. And I would like to thank Mr. Dr. Shobik Theory for inviting me in this session. So let me open my slide. Am I audible clearly?
Yes, ma'am.
Okay. Let's give a moment for Is my slide visible to all?
Yes, ma'am.
Okay, thank you again, Dr. Shobik Theory, for inviting me, and it's a great privilege for me to be a part of FSTN Exploration Foundation. So today
Welcome, ma'am. Good evening, ma'am.
Yeah, good evening. So today I'm going to talk about the nutrition and health. Although all we know about the food, so let me introduce a little bit about food and nutrition. So food can be anything edible, and which might be solid, semi-solid, or liquid. When solid, and they are digested and absorbed in the body, proves useful to it. And this substance not only keep the person alive, but also provide energy used for growth and development, regulate the body processes, and protect the body from diseases. Now, nutrition. Nutrition is as the science of foods, nutrients, and other substances that contain and of their actions within the body, including ingestion, digestion, absorption, assimilation, and digestion. Among the nutrition, nutrients have been defined as chemical substance, which might be organic or inorganic substance that found in foods which cannot be synthesized at all or in insufficient amount in the body, and are necessary for life growth and tissue repairment. Balanced diet is essential for a healthy life. A balanced diet means which includes a variety of foods in adequate amount and correct proportion to meet the day's requirements of all essential nutrients such as protein, fats, carbohydrates, vitamins, minerals, water, and fiber. There is a close relationship between nutrition and health. Food, which is a basic and foundational part of our lives, food plays a vital role for human existence, such as the air we breathe and the water we drink. So, if we eat a proper diet, take plenty amount of water, do regular exercise, and lead a reduced stressful life, so that will lead us a healthy life. If we do the classifying of food, food can be classified in accordance to their chemical property, their function, their essentiality, their concentration, and their nutritive value. There are 5 basic food groups suggested by the Indian Council of Medical Research. These include cereals, grains and products, pulse and legumes, milk and meat products, fruits and vegetables, fats and sugar. According to the chemical nature, they can be classified as carbohydrates, vitamins, proteins, dietary fibers, fats, water, and minerals. According to their function in the body, energy-giving foods, carbohydrate, fats, and proteins are responsible for providing the energy. As for example, rice, chapati, bread, potato, sugar, and so on. Bodybuilding foods, proteins, fats, and carbohydrates also considered as bodybuilding food. because they participate for the formation of several body tissue. For example, fish, meat, chicken, eggs. Protective food. Vitamins and minerals are considered as the protective food for the body. They protect us from various diseases. According to its mass, depending on the quantity necessary for cells and organisms are classified as macronutrients and micronutrients. Macronutrients required in large quantity daily. Proteins, carbohydrate, fats, and are macronutrients, and they are the basis of any diet. Micronutrients are needed in small quantities, usually amounts less than milligram. These nutrients are involved in regulating metabolism and energy process. They are vitamin and minerals. So these are the examples of macronutrients and micronutrients. According to its origin, food can be divided into animal source and plant source. Functions of food. Foods can provide physiological, social, and psychological functions. Under the physiological functions, it provides energy and responsible for body build and protects us from several diseases. So if someone lead a healthy body, so they can get a healthy mind. Healthy body and healthy mind gives us a happy life. So again, as we are talking about the nutrients, so these nutrients which are present in the food and consumed in our body for its vital functions. According to World Health Organization, these nutrients must come from food and they are vital for disease prevention, growth, and good health. There are several constituents such as already told macronutrients and micronutrients. Carbohydrate, this is the chief source of energy which provides 4 kilocalories per gram, and carbohydrates consist of carbon, hydrogen, oxygen in a ratio of 1:2:1. The building blocks of all carbohydrates are simple sugar, which is called monosaccharide, such as glucose, fructose, galactose. And disaccharides, which consist of 2 sugar molecules linked, like maltose, sucrose, lactose. Polysaccharides, which is a polymer of glucose, or monosaccharides like starch, glycogen, sulfur. In daily basis, carbohydrate intake should be in a range of 50 to 70% out of the total energy intake for adults, and for child it should be 40 to 60%. Living organisms use carbohydrate as accessible energy to fuel cellular functions. They are the most abundant dietary source of energy for living all beings. About 80% of the total energy comes from the carbohydrate. Instead, carbohydrates act as an energy source instead of protein. Carbohydrates are intermediates in the biosynthesis of fats and proteins. Carbohydrates aid in the regulation of nerve tissue and is the energy source for the brain. Formation of the structural frame of RNA and DNA, they help in the modulation of the immune system as well. So, this is the digestion and absorption procedure for the carbohydrate. The digestion of carbohydrates starts from the mouth in the presence of salivary alpha amylase, then in the small intestines pancreatic in the presence of pancreatic alpha amylase, and it is transported throughout the body or absorbed in the blood through the active transportation system. But although there are several functions of carbohydrate, but overeating of carbohydrate may cause of health risks. So it may cause of obese, type 2 diabetes, high blood pressure, heart disease, high cholesterol, gallbladder disease, fatty liver disease, sleep apnea, osteoarthritis, as well as cancer also. Next, protein. Proteins are the essential constituents of the diet. Proteins are made up of amino acids. Amino acids are needed for replacement and growth of the body parts. Amino acids are classified as essential and non-essential amino acid. And we know essential amino acids cannot be synthesized by the body, so we need to depend it upon on the food. So according to ICMR, recommends 1 gram of protein per kg of body weight for adults. So the amount of the protein can be increased in child, pregnant and lactating mothers by 1.5 to 2 gram per kg of body weight. These are the sources of protein. And there are list of essential and non-essential amino acids. Function of proteins. Protein help in synthesis of enzymes, immunoglobulin, plasma proteins and hormones in the body. Protein helps in growth and repair of body tissues. Proteins are secondary source of energy during deficiency of carbohydrate and fat. So carbohydrates and fats act as a sparer for protein. Protein helps in forming hemoglobin. Protein helps in antibody formation also. So this is the procedure for digestion and absorption of protein, and it also started from the mouth. It started from the stomach in the presence of a cell and pepsin, and it can be degraded in the presence of protease, and it is absorbed through the active transportation system. Due to the deficiency of protein, as protein acts as a worker for the body, and this is very much essential for the body's function. So due to the deficiency of protein, several diseases can be occurred, like sky skin, swollen abdomen, swollen ankles, hair loss, all for old person like this, wrinkled skin, severe muscle loss. Fat. Fat are concentrated source of energy containing carbon, hydrogen and oxygen. Fat are solid up to 20 degrees centigrade, and if they are liquid, at that temperature they are oil. Fat are insoluble in water, and fat is deposited as adipose tissue in the body and perform essential functions in the body. So fats are composed of fatty acid and contains oxygen, carbon, hydrogen. If we classify the fat, we can get simple fat, compound lipids, direct lipids. Generally, we can get energy from the simple lipids or fat, that is triglycerides. And the phospholipids are the component of the cell membrane. And from the cholesterol, several essential compounds for the body like hormones are synthesized. Fat also can be classified into two types like saturated fat and unsaturated fat. Saturated fats, these have full number of hydrogen atoms, and these are from animal sources like butter, ghee, vegetable oil. Unsaturated fat, this contains 1, 2 or more double bonds of fatty acids. These are extracted from vegetable sources. As for example, soybean oil, sunflower oil. 15 to 20% of the total calorie requirement should be from fat. That is about 44 gram to 77 gram of fat per day if we eat 2000 calories a day. Fat supplies energy 9 kilocalorie per gram, improve the palatability of food, supports body organs like liver and kidney, provide insulation and thermoregulation against cold, provides essential fatty acid which helps in growth, promotion and maintenance of skin integrity, helps in formation of hormones in the body, helps in transportation of fat, soluble vitamins. Now vitamins are organic compounds that people need in small quantities. Most vitamins need to come from food because the body either does not produce them or produce very little. Different vitamins play different roles in the body, and a person requires a different amount of each vitamin to stay healthy. And it is classified into fat soluble and water soluble vitamins. Fat solubles are vitamin A, D, E, and K, and under the water soluble vitamins, there are vitamin B complexes like B1, 2, 3, 5, 6, 7, 9, 12, and vitamin C. Vitamin A is retinol, found in foods of both plant and animal origin. It is essential for eye health. So, deficiency of vitamin A is decreased resistance of infection, dry scaly skin, night blindness, Barrett's spots, keratomalacia, which is the softening of the cornea, In daily basis, we need 0.4 to 1 milligram of vitamin E, and green leaf vegetables and yellow-orange fruits, vegetable like mango, papaya, pumpkins are source of better health. Vitamin D, which is synthesized by the sunlight, and vitamin D is essential for bone growth. In daily basis, we need 400 international units of vitamin D generated in the skin by action of ultraviolet rays of sunlight. Food sources are milk, butter, cheese, eggs, fish liver oils, foods which have been fortified by the addition of vitamin D. Increases industrial absorption of calcium, phosphate, and it also mineralizes of the bones. Vitamin D is also essential for the dental health. It prevents tooth decay and loss, strengthens the gums, and reduces risk of any oral infection. Due to the deficiency of vitamin D, several diseases can be occurred. Rickets, which is characterized by reduced growth and softening of bone. This disease is generally seen in children due to lack of vitamin D. Children develop very thin and deformed bone. Osteomalacia. Osteomalacia is similar to rickets, but is usually seen in elderly people suffering from vitamin D deficiency. This disease reduces the absorption of calcium in the body, leading to soft and deformed bone structure, bending of the spinal cord and legs, increase the risk of fracture. Osteoporosis, being most common in elderly where the bone density reduces, make more sporous in nature and causing increased risks of broken bone and fractures. Vitamin E is an antioxidant formed of chemical substance called tocopherol. 15 international units per day of vitamin E is required, and vitamin E can be found in milk, oils, eggs, leafy vegetables, papaya, grains, nuts. The main function of vitamin E is antioxidant, which prevents the oxidative stress, and it also acts as cofactor in electron transport system and prevents or delays the aging. Vitamin E deficiency causes of anemia, hair loss, muscle weakness, dry skin, leg cramps, cancers, blindness, immune impairment, fertility problems. Now, vitamin K is called as anti-hemorrhagic vitamin. It is required for the formation of prothrombin in the liver of the second factor of coagulation. Due to deficiency of vitamin K, the prothrombin content in blood may lead to bleeding disorder. World Health Organization suggested 55 microgram per day of vitamin K in adult, and it can be found in leaf vegetables, cereals, and fruit. Now, already we know about the nutrition, although nutrition gives us a healthy life, but there are several problems associated with the nutrition. Like already we have seen, inadequate macronutrients causes of several diseases, as well as inadequate micronutrients also responsible for several diseases like immunodeficiency. Excessive macronutrients responsible for like obesity, type 2, cardiac disease, and so on. So, as nutrient causes and at several stages in several disease, so for getting a healthy life or for preventing a disease, scientists thought about the functional food. And the functional foods first coined in 1980. According to the European Food Safety Authority, functional food refers to a food which beneficially affects one or more target functions in the body beyond adequate nutritional effect, in a way that is relevant to either an improved state of health and well-being and a reduction of risks of diseases. And if we survey the several researches which are going on from 1980 to 2019, we found several studies regarding the functional food. So despite the high referencing of functional food research in the last decades, there is still limited evidence coming in the human trials. If we see among this large number of, like in 1980 to 2009, there is 10,208 manuscripts, and in 2010 to 2019, there is 32,914 manuscripts, which were going on study on functional food, but among them only about 3% was in clinical trial. So there are some factors affecting efficiency of functional food, like human physiology and combination with various foods. Combination of functional food with various foods. If we say about the human physiology, the effect of functional foods depends on the homeostasis of normal physiology, as well as the function of the functional food varied on the pathophysiological condition of the human health. And when we take the functional food alone or in combined with the other foods, the effect of functional foods are varied. So for getting the effects or knowing the perfection of the use of the functional food, we need to do some clinical trials on human. So we need to focus on this point also. And on the basis of nutritional epidemiology, if we see, there are several researches which are going on the survey, like for the assessment of the nutritional values or the food habit. There are some classical assessments, like food frequency questionnaires, 24-hour recalls, and dietary history. So these data always not provide us the actual scenery. This may be the cause of biasness. So we need to move from the classical assessment to alternative or complementary tools, like assessment for biomarkers of intake metabolite or metabol types, or to develop a smart or herbal device. So from there we can quantitatively measure what kinds of foods already the patients or people taking. And from the assessment, from the alternative or complementary assessment, we can understand the impact of functional ingredients or functional foods, like through the functional impact of functional food on gut brain, gut urinary tract, gut skin, and more. And so using this data, it will help us for tailoring personalized and effective dietary advice for better disease prevention. Now, if we focus on the real lifestyle, like people now moving into the Western dietary pattern and leading a very sedentary lifestyle, like these Western dietary patterns may cause of several oxidative stress, inflammation, and deposition of fat. And this oxidative stress can be measured using several biochemicals, like here we mentioned some biochemicals, and as well as due to the Western food habit, it reduces antioxidant demand and reduce the hepatic lipid metabolism. And as it increases the inflammation, and inflammation as a marker for measuring the inflammation, we can measure the corpuscle tumor necrosis factor, which are elevated. And due to the fat deposition, adiponectin is reduced, leptin increase, tumor necrosis factor also increase, as well as interleukin-6 increase. So all these are responsible for leading a non-alcoholic fatty liver disease or non-alcoholic steatohepatitis. And if we compare this Western dietary pattern with healthy dietary patterns, there is all things are approaching. And these healthy dietary patterns are responsible for the reduction or prevention for the fatty liver disease. And when we eat the overnutrition or due to the malnutrition, we already have seen that Western food habits can lead to the non-alcoholic fatty liver disease. So malnutrition lead our normal liver into the macrosteatosis condition, which is called the non-alcoholic fatty liver disease. And this malnutrition also responsible for gut microbiome dysbiosis. And if we see what happens actually inside our liver, and inside your liver, it is responsible for the hepatic injury, lipotoxicity, inflammation, oxidative stress, and fibrosis. And if you see the microscopic view of the liver, we can see this figure is from a study on the mouse histology. So if you see the hematology, hematoxylin and eosin staining, so from the here these are the macrosteatosis. So generally our liver can contain 5% fat of its weight, but during the fatty liver, the expression of fat or deposition of fat are elevated. And here we can see the range colors, and which from the Saras red staining, the range color is representing the fibrosis. So these NAS conditions, when the NAFOs or non-alcoholic fatty liver disease leads to the non-alcoholic state of hepatitis, and if we do not take any initiative to prevent this or to stop this progression, this can lead to cirrhosis, even though this can be lead into the hepatocellular carcinoma. So several studies are going on for treating the non-alcoholic state of hepatitis or non-alcoholic fatty liver disease, although there is no FDA-approved drug. So there are some studies I found in annual review of nutrition 2023. They checked the effect of polyunsaturated fatty acids in liver and RBC of the human and NAS mice. And if you see the pathway for the conversion of the essential fatty acid like linolenic acid, and we can see the conversion of this, and so finally we can get the docosahexaenoic acid, and this essential fatty acid or polyunsaturated fatty acids are responsible for beta oxidation, which reduces the lipotoxicity. So here they represent some data and the effect of the polyunsaturated fatty acids. The expression of the polyunsaturated fatty acids are reduced in the NASH patient. This is the data from human data, and this one is from animal data. So in both cases, they found that the expression of polyunsaturated fatty acids are lower in the disease states, as like if we compare between the simple steatosis, the NAS. So on the other hand, the treatment with the DHA, that is docosahexaenoic acid, that elevate the polyunsaturated fatty acid levels in the liver as well as in RBC. So note, taking the sufficient food, there is an importance at which times we are taking the food. If we take the much more nutrition, that also causes of disease, and if we take the food in an abnormal times, that may also lead a disease condition. Our body follows a circadian clocks, and as if there is this synchronization of the taking of foods, and that will also alter our metabolic activity, and that also alter the sleep cycle, and that also alter the function of the gut microbiome. And due to the alteration of the food habit, that may alter the metabolic regulation, and which may be responsible for occurring of several diseases like obesity, type 2 diabetes mellitus, cardiovascular disorder, as well as cancer. And this can be prevented by intermittent fasting. And if you see the study of potential, which are found in annual review nutrition in 2017, they showed how they showed the cardiac regulation of behaviors, hormones, physiology, metabolism, and energy. So generally, if we take the food, the daytimes, that what happens, our liver is active, and the metabolism is high, and the pancreas secretes the insulin, and there is the lipogenesis, and in muscle glycolytic metabolism is conducted. But what happens in case of night, the cycle is opposite. And if we alter the cycle of the food habits, so there might be several there might activate several risk factors like uh, uh, several disorders in the regulation of hormone, and they may cause of several diseases like cardiovascular disease, especially cardiovascular disease, and as well as cancer also. So, and due to this, and they checked several intermediate fasting conditions. Like I found a research like Varady and his team conduct a research on providing different food at different stages. Like they select a group for alternate fasting day, and this apple symbol indicating the time of providing food. So like first of all, they started from the fasting, and they started with alternative fasting day. And here they provide food in 5:2 ratio. Like in a week, they provide only 2 days. They keep the people in 2 days fasting, and they also maintain a time restricted eating, so which is called TRE. So they divided their study groups into 3 groups, and after the research, they finding that the cardiometabolic benefit of intermittent fasting. If we see, or if we compare the alternate day fasting and the 5:2 diet and time restricted eating, we can see in all cases body weight, blood pressure, insulin resistance are decreased. On the other hand, in case of alternate day fasting and the 5:2 diet ratio they found the reduction of low density lipoprotein cholesterol, triglycerides in both cases. Okay, but in time restricted eating is responsible only for reducing the oxidative stress. And here the data I represent. So in this data proves their finding. So there are several data. So modified food habits, and they keep the several groups like first day lunch and first day dinner, and like how they kept their groups in different conditions, like with exercise or without exercise, and how they are providing the food with, and like as libitum food, and somewhere they mention the prescribed calories also. So these are the data, and okay. So all these cases, in case of 5:2 diet, you can see some the blood pressure is reduced, and hemoglobin also reduced, and sir, NT is represent not tested, and this null is indicating the data is not significant, and the other things are indicated the significant decreases or increases of flavor. And in some other data, they also compared the healthy non-obese adults, and healthy adults, and they provided alternate day fasting for 15 days, 22 days, and 1 day, and they compared their groups, and like for weight gains in the first group, no significant gains, in second two groups in the weight was significantly reduced, as well as they found the significant changes in blood glucose level in first group, and other groups glucose and insulin, and inflammatory markers was also altered there. and modified fasting groups provide the better result other than those groups. So, what can we get from this data? So, the timing of food intake is an important determinant of human health and disease risk. The potential effects of prolonged nightly fasting on energy intake, sleep, physical activity, and circadian activity rhythm may act in concert to reduce the rates of cardiometabolic disease and cancer. So, we need to focus on our nutrition or nutrients not only according to our taste, but we need to take it in a timely manner and in a sufficient quantity. Thank you all. Thank you for your questions. Thank you.
Thank you so much, ma'am, for this beautiful presentation. From the very beginning of our food and nutrition, like what is food, what is nutrition, what is nutrient, to the vast thing you have presented in just a way. There is not a moment for the distraction. Thank you so much, ma'am, for this beautiful presentation. I hope the students also like this. And if you have any queries, please raise your hand.
Thank you.
Please, if you have any queries, you can raise your hand or just open your mic and ask to ma'am. Basically, you have described so descriptively and broadly. I think there are no more queries. So, we are going to our next part where ma'am will be the judge for our 5 in 5 presentation. So, already we know about this thing, and there are 6 participants of this presentation: Priyanka Roy, Pallavi Chatterjee, Kiki Raut, Oshmita Chatterjee, Suranjana Sen, Jyoti Pachia. I think everyone, you all are present in these Google Meet, and I just want to share this activity with everyone, that there will be a competition in 5 in 5 slide presentation in 5 minutes. So that's why the topic is given 5 in 5, and the topic are these Rashtriya Poshan Month theme, complementary feeding or tribal focused nutrition or anemia or exclusive breastfeeding. So they have made the presentation of any of this topic 5 slide in 5 minutes. So, so I would request the first one. So ma'am, can we start now?
Yes, please.
Okay. So I would request the first one, Priyanka, to first introduce yourself and then please start your presentation and present your topic. There is no language barrier for that. You can use Bengali, English or Hindi, anything for your presentation. Priyanka, are you there?
Yes, ma'am, I'm there.
Yeah. Okay. So please present your PPT. You can present your PPT from phone. I am telling to everyone, you can present your PPT from phone itself. Please present your PPT and then introduce yourself. After presenting, after introduction, you will have 5 minutes to present your PPT.
Okay, ma'am. Ma'am, I'm sharing my screen.
Yeah. Yeah, please start. So the time is 9:51. So you have time from 9:56. Okay, please start.
Okay, ma'am. Good evening, everyone. Respected ma'am, sir, and my dear friends. Today, I am Priyanka Roy, student of MSc 3rd semester, Department of Food and Nutrition, Swami Vivekananda University, will be presenting tribal focused nutrition. What is tribal focused nutrition? Tribal community is a very indispensable part of our Indian culture, and India is an agricultural country. So connecting to our roots, I have just chosen this topic because their culture is very different, be it in their nutrition, religion, festivals, or any dance of their own. And there are different tribal cuisines as well as from Sathals of West Bengal to different types of Jaroas in Andamanis and Chhattisgarh tribes. They are all different from each other. And their food actually revolves around different types of wild shoots, tubers, rice, etc. So there are different types of tubers which are getting in forest and all. So these are very nutritious and like they have got different nutritional values which are important to their health. And I want to focus on this wash this code in tribal community because I have chosen this topic because it is a very unique topic, and actually I wanted to connect myself with the roots of our community. So that is why I have chosen this tribal community. And this wash actually means water quality, sanitation, and hygiene. Along with nutrition, it is very important for sanitation, hygiene, and safe water quality. And here are the 8 interventions which can be taken for a safer, like to improve the nutritional status of tribal children and all every community, every tribal community. So these are strong preconception care. It has been observed in the research that over 40% of the women in the tribal community are like malnourished, and malnutrition is a very, like they are very prone to parasitic infections, and which is a very like potent cause of anemia. Anthropometric drive and teleconsultations, community-led nutri-gardens, nutri-herbs, and nutri-kitchens. Enhance dietary diversity with regional nutrition kits, proper practicing proper sanitation and hygiene, mobilizing more federations and tribal self-help groups, and engaging faith leaders and tribal healers, community-based management of severe acute malnutrition. Thank you. That's all for today. I conclude, and at last, I just want to tell that these are the different tribes of India. So I have just put it up in a collage, and for this tribal community, it is very less to talk about. So like it is a vast area where one can actually explore. So thank you everyone for your patience.
Thank you, Priyanka. I would ask ma'am if ma'am have any queries.
Yes, ma'am, sure.
Thank you, Priyanka, for your nice presentation. And you finished your presentation within 2.5 minutes. So, yeah, you can talk a little bit more about the tribal nutrition. And my question is to you that as in India, there are several types of tribals. So, which ones you would like to focus more, like malnutrition or sanitation, or any others?
Ma'am, actually, Sathals of West Bengal, like I would like to focus because West Bengal is my native region. So I would more means a few months ago I had visited Shantiniketan. So they also had certain Sathal tribes, and they were actually malnourished. So I would like to focus more on malnutrition. But again, this poor sanitation and hygiene is also related with malnutrition.
Okay. Thank you, Priyanka. Thank you, sir.
Welcome. Thank you, ma'am.
Thank you, Priyanka. So I would request the next one, Pallavi Chatterjee. Pallavi, are you there?
Yes, ma'am.
Okay. Pallavi, please present your screen, and after that you give your intro, and after that the 5 minutes time will be given to you. Yeah, you should stop your presentation at 10:01. Okay, it's
Ma'am,
9.
is my screen visible?
Yes, yes, visible. Please, press the play button.
Play button.
Yeah, that.
Is it now visible?
Yes, yes, yes. It is visible individually. Yeah, yeah. You can start.
Previous slide. Uh, hello? Am I audible?
Yes, yes. You are audible. You are visible. Please give your brief intro and start.
Good evening, ma'am. Good evening, everyone present here. I am Pallavi Chatterjee. I did my BSc in Nutrition from JU and MSc in Applied Nutrition from All India Institute of Hygiene and Public Health. I completed Certified Diabetes Educator and Certified Maternal Child Nutrition course from Adversity. Now I am a practicing dietitian attached to Peerless Hospital City Diagnostic Center and Apollo Clinic Parsacas. So I would like to thank FSTN for providing me with this opportunity. I have chosen exclusive breastfeeding as my topic. I think that nutrition is an indispensable part from womb to tomb. Hence, exclusive breastfeeding is absolutely necessary for a healthy future. And if a baby is healthy, then we'll have a healthy future. Hence, I chose this topic. So I'm starting my presentation with the recommendations. 1 minute. So WHO and UNICEF recommended that children should initiate breastfeeding within the first hour of delivery and exclusively breastfed for the first 6 months of life, meaning no other food or even liquid should be given to the child. Infants should be breastfed on demand, that is, when the child asks for it during the day or at night, and no bottles, teethers or pacifiers should be used. The child should be only breastfed, and in case the child is unable to be breastfed, then the breast milk should be expressed and should be fed by a bowl and a spoon and not through bottles and all. And from the age of 6 months, the child should start weaning with the complementary food, but breastfeeding should be continued till 2 years of age. The most important thing is that the child should be fed with the colostrum, which is the thick yellow fluid that is secreted till the third day of delivery. It is extremely nutritious and should be fed to the newborn. It defends against harmful bacteria and viruses, and also stimulates the baby to produce antibodies and protects the baby against any kind of allergy. Moving on to the breastfeeding techniques, there are different types of breastfeeding techniques like cradle hold, cradle hold, laid back hold, sideline, football hold, and so on. I have given a picture of correct latching, where both the nipple and areola should be inside the baby's mouth. The baby should suck the nipple and areola together, and not just the nipple. I have shown good attachment versus poor attachment over here. And another important thing is that the baby should be burped after every feed to avoid regurgitation of milk. Here I have again shown good latch versus poor latch. While breastfeeding, the baby's mouth should be wide open. It should be just flanked. Lips should be flanked just like fish, and the tongue should be over his lower gum, and the chin should touch the mother's breast. So moving on to the benefits, breastfeeding has enormous benefits to the mother as well as the child. Now coming to the breastfeeding benefits for the mother, it promotes good bonding between the mother and the baby. It reduces the risk of postpartum depression and stress for the mother. It helps to reduce postpartum hemorrhage by delaying menstruation. Breastfeeding conserves iron stores by prolonging amenorrhea. Mothers who breastfeed their child are at a lower risk of developing breast cancer and ovarian cancer. Breastfeeding burns extra calories uh, uh, that has been gained during pregnancy and thus helps in uh, reducing the postpartum weight loss faster and helps the mother to regain back the pre-pregnancy weight. Breastfeeding also releases a hormone called oxytocin, which contracts the uterus to its pre-pregnancy size faster. It serves as a natural contraceptive for the mother and helps in birth spacing. Next, coming to the breastfeeding benefits for the baby. Breastfeeding is breastfeeding enhances the IQ of the baby. Breast milk contains all the essential nutrients in correct amount that the baby needs in the first 6 months of his life. It also acts as the first vaccine for the baby. Breast milk is easy to digest and readily available. Breast milk has optimum temperature. Breastfeeding helps to build and support the immune system of the baby. It enhances baby's brain and visual development. Uh, uh, Breastfed infants are at a lower risk of allergies, different kind of infections, GI infections, respiratory tract infections, and so on. Breastfed infants are at a lower risk of developing any kind of NCDs, childhood obesity, diabetes, hypertension, etc. Breastfed infants have a lower risk of sudden infant death syndrome, that is SIDS. So I think then that's all for today. Thank you for your patient hearing, and thank you FSTN for providing me with this opportunity. Thank you.
Thank you, Pallavi, for your presentation. I would ask ma'am if she has any queries. Ma'am, please.
Yeah. Thank you, Pallavi, for your nice presentation, and you properly utilized the times and you maintained the 5:5. Okay, thank you so much. I have no question.
Thank you, ma'am.
Okay. So Tithi, are you present? Tithi Raut? Tithi Raut, are you present? Poshmita Chatterjee?
Yes, ma'am.
Yeah, please present your screen from the phone or any other.
Yes, ma'am. Ma'am, is it visible?
Yes, it is visible, and please, before starting your presentation, give an intro and then start your presentation. 10:09, you will complete by 10:09. 10:10, okay? You can start.
Yes, ma'am. Good evening all. Today I, Ashmita Chatterjee of Gokhale Memorial Girls College, is presenting before you my presentation on unleashing tribal focused nutrition. Firstly, understanding what is tribal nutrition. Tribal communities have unique cultural and dietary practices that influence their health outcomes. Understanding their tradition, beliefs, and challenges is very crucial for designing effective nutrition interventions. Thus, by acknowledging their cultural context, we can develop strategies that respect their heritage while promoting towards a better health. Tribal diets are characterized by rich of whole foods and indigenous superfoods such as wild game meat, fish, roots, shrubs, tubers, and berries. These nutrient-dense foods are very minimally processed and packed with essential vitamins, minerals, and antioxidants. These diets are often very diverse and incorporating local available ingredients. Traditional cooking method are their main focus. We can also talk about embracing these tribal focused nutrition, which can lead to a varied health benefits. Over here, I've mentioned few of them. Heart diseases, diabetes, and obesities are some of it. High intake of fiber, omega-3 fatty acids, phytochemicals are among the main, which helps in improvement of digestion, cardiovascular health, and immune function. Over here, I've shown a thali of the Khasi tribe, where they have included several rice products along with the meat. Now, there are several challenges that are faced by the tribal communities due to their limited access to nutritious food, cultural erosion, and historical trauma. These lead to higher rate of diseases such as malnutrition and poor health outcomes. It is very crucial to understand to understand their nutritional strategies while we are building them. Over here, I have shown that many states of India are very poorly affected by malnutrition, and here is a graph which shows the stunted, wasted, and underweight of Indian people. Talking about empowering tribal nutrition, we can do that by providing affordable nutrition food and enhancing nutrition education programs. Now, that can be improved by giving them physical activity and providing them with a sense of community within themselves. Education is one of the main points that is needed to be focused while empowering tribal nutrition. Younger generations must also be encouraged to make healthier choices among this, and it will also provide them to a sense of pride to connect with their roots and history. These are some of the health strategies which are launched by the Government of India for promoting tribal health and wellness. Educational programs and community-led nutrition programs are very important for planning, implementation, and evaluation. Fostering ownership and sustainability is the main point among them. We can empower them to make informed and nutritious choice by helping these things. Educational programs which are highlighting tribal nutrition can inspire and guide future initiatives. From school-based initiative to traditional food revitalization, this will provide a positive change among the nutrition of the tribal community. Hence, I would like to conclude my presentation by saying that it is a great way that we can improve traditional tribal nutrition by educating people, keeping in mind their hygiene, as most of their nutritional abilities are coming from natural farming. We can improve that area as well. Thus, cross-cultural understanding and healthy eating can be a great way to enhance their nutrition as well. Thank you.
Thank you, Ushmita. I would ask ma'am if there are any queries.
Thank you, Asmita Chatterjee, for your excellent presentation, and you clearly mentioned about the tribal nutrition. Thank you so much. Thank you, ma'am.
Okay, Tithi, are you present now?
Yes, ma'am.
Yeah, please present your screen. Give a brief intro about you and then start your presentation.
Okay.
Hello everyone and good evening, and my respect to our keynote speaker Rejina ma'am and all the faculties and teachers and students present here. I am Tithi Raut. I am 5th SEM BSc Honours student of Clinical Nutrition and Dietetics of Swami Vivekananda University. So today I am going to talk about the tribal focused nutrition in the celebration of National Nutritional Month. So what is tribal focused nutrition? That is addressing the unique dietary needs of indigenous communities. Let's come to a brief introduction. Tribal focused nutrition is a specialized approach to addressing the dietary and nutritional needs of indigenous or tribal communities around the world. This approach recognizes the unique cultural, geographical, and historical factors that shape the dietary habits of these communities. So for that, we have to know about the major tribes in India. I have listed down some: Gond, Bhil, Santhal, Kashi, Naga, Mizo, and Kuki. Let's come to the importance of the tribal focused nutrition. Here I have listed some points like cultural preservation, nutritional health, traditional ecological knowledge, respect for self-determination, community engagement, health equity, and global food security. So we know that importance of tribal focused nutrition is much more needed in today's time because they are an integral part of our community, and we need to know what is their difference and what are they culturally rich of. Next, we come to the nutritional challenges faced by tribal communities. First, we talk about the limited access to nutrient-rich foods. We know that some of the tribal communities live in the rural and remote areas. Living there, they can't get the access of the supermarkets and the fresh foods and the marketing communities. So they are deprived of the most common area of our markets. Second is lack of education. There is, of course, a wide range of lack of education in the tribe community of the India. Next is food insecurity, poverty and economic disparities, traditional diets, health disparities, environmental factors, and cultural barriers. Here I have mentioned some common dietary chart for tribal communities. Grains, millets, maize, rice, proteins like pulses, lentils, beers, dairy products, vegetables, locally grown vegetables, fruits, seasonal fruits gathered from the forest, beverages, water, herbal infusions, occasionally fermented drinks, meat and fish, spices and herbs. Next, we come to the strategies for tribal focused nutrition. This is the main important part because here I am saying that promoting tribal focused nutrition requires culturally sensitive approaches that take into account the unique dietary habits, traditions, and challenges of tribal communities. Here I have listed down some strategies for addressing nutrition in tribal communities like cultural competence and community engagement, nutritional education and awareness, food security and access, diverse and balanced diets, traditional food revival, nutrition-sensitive agriculture, food safety and hygiene, community-based initiatives, healthcare and nutritional support, advocacy and policy change, research and data collection, and sustainability and long-term planning. Implementing these strategies requires a collaborative approach involving tribal leaders, community members, government agencies, NGOs, and healthcare providers. Last, join the movement for tribal-focused nutrition sensitization. We know that the tribal communities around the world are rich in culture, tradition, and history, yet they often face significant nutritional challenges that impact their health and well-being. So it's time to take action and make a difference. Our Honorable President, Srimati Draupadi Murmu, she belongs to the Santhal tribe of West Bengal. So she is the one who can develop in tribal communities and also the upliftment. She can help in the upliftment of many backward scheduled tribes and inclusion of other tribes in the list of scheduled tribes. So individuals who work tirelessly to improve tribal community nutrition deserve recognition and support for their valuable contribution. Thank you.
Thank you, Tithi, for this presentation. I would ask ma'am if there are any queries.
Thank you, Titi, for your excellent presentation. I have a quick questions to you. You search a lot of things regarding the tribal nutrition. Can you tell me which types of nutrient deficiency mostly they are suffered?
They mostly suffer from iodine and other macronutrients like and dairy products. Ma'am, are you asking for the specific nutrient?
Yeah, like this. Okay. So they are mainly suffered from the deficiency of micronutrients, right?
Yes, yes.
Okay. Thank you, sir.
Thank you.
Thank you, Tithi. I would request the next one. Suranjana, are you present? Suranjana said,
Yes, ma'am.
please present your screen and give a brief intro and start your presentation. You have 10:20, okay? You have to stop your presentation by 10:20. Please start.
Ma'am, is it visible?
Till now not visible, only your Google Meet is visible. Yeah. Please start the play button. Yeah. Start.
Good evening, everyone. I am Suranjana Sen, RCI registered special educator. Now I am pursuing my MSc degree from Swami Vivekananda University. Today's my topic is about latch, exclusive breastfeeding. An exclusive breastfeeding. We know that breast milk is the first vaccine for newborn. So during breastfeeding, a proper latching makes a good attachment between mother and newborn, both physically and mentally. Let's have a look on about latch. And latch is stand for 5 components, that is latch on, L for latch, A for audible swallowing, P for type of nipple, C for comfort, and H for hold. Each component is scored from 0 to 2 and the total score ranges from 0 to 10. As you is the score less than 8 is considered low or unsatisfactory latch-on process. As you see, latch and latch position, the nostrils should be clear when the baby is going to the latch-on process. Lips curled out, mouth should be wide, and full rounded cheeks is visible. This picture is described the proper latch-on position. Then we can see the incorrect and correct latch-on process. Left side is described the incorrect latch-on process, and right side is described the correct latch-on process. The steps is baby's mouth is open wide, then tongue is over his lower gum, lips are curled out, and baby's chin firmly touches mother's breast. This is the proper latch-on process. If you see, the baby's mouth is barely opened and behind the lower gum, and lips are curled in, and chin barely touches mother's breast. This indicates incorrect latch-on process. Thank you.
Okay, Shiranjana, thank you for your presentation. Ma'am, if you have any queries.
Thank you, Suranjana, for your presentation. And you can take more time also. So, but within short time, you express a lot of things. Thank you, Suranjana.
Thank you. Okay, so our last participant, Jyoti, are you present?
Yes, ma'am. Good evening, everyone.
Yeah. Please present your screen and give a brief intro and start your presentation. Please complete your presentation by 10:25.
Okay. Ma'am, I'm not able to share the screen. I think Shranjana has not stopped her sharing screen now.
Yeah, Shiranjana, please stop your. Yeah. Yeah. Jyoti, you can start your presentation.
Yes, ma'am. Is the screen visible, ma'am?
Yeah, it's visible. Please start the presentation.
Okay. A very good evening to all of you. This is Jyoti Pachisia here, guest lecturer from the IMS Mukundapur and also a practicing dietitian. And the name is The Healthy Eating Habits. On the occasion of National Nutrition Month, I will be presenting the
Jyoti, one second. Would you please go to the slideshow mode? Slideshow mode.
Yeah. Just a moment, ma'am. Just a moment. Is it visible, ma'am, now?
It is visible, but you are not in slideshow mode. Okay. So see, below there is a slideshow icon. Yeah, this one. This press.
Is it now okay, ma'am?
No, not okay. Please start the from beginning. Please click the from beginning.
Yeah. From beginning. is not working.
Just a moment, ma'am. Just a moment, ma'am. Just a moment. Is it visible now?
Not yet. Or carry on.
Okay. Ma'am, it's
Jyoti, your screen is visible, but your screen is not in full screen. So,
Yeah.
okay.
okay, carry on, carry on. No problem, not an issue.
I'm trying it again, so if it is possible. Okay, good evening everyone. This is Jyoti Pachisia here, the lecturer from the IMS Mukundapur and also practicing dietitian under the name Healthy Eating Habits. On the occasion of National Nutrition Month, I will be presenting the topic which is based on the principles for optimum complementary feeding. Now, when we say the term complementary feeding or the complementary practices, it refers to the process of introducing foods when mother's milk or its substitutes are no longer adequate to fulfill the nutritional needs. The complementary phase, which starts from the 6th month till 20 and continues till the 24 months of the age, is a highly crucial because many infants begin to suffer the malnutrition. Now, the process of the feeding reflects on the principles which all of you can see in the slide. It reflects on the principles known as the FATWA principles, where F stands for the frequency of the feeding, A stands for the amount of the feeding, T stands for the thickness of the food, B stands for the variety in the food, A stands for the active or the responsive feed, meaning how the baby actually responds when it is feeding is started, and H, the most important principle, is the hygiene. Now,
Yes,
as
not your slide changing, Jyoti. Only the first slide we are able to see.
okay,
When you present which slide you present, please click on that slide.
okay, ma'am, I am doing it that way. I'm presenting this one. I'm presenting this one. Okay, I'm saying it again, ma'am. So when it is the term called the complementary feeding, it actually refers to the process of introducing foods when mother's milk or its substitutes are no longer adequate to fulfill the nutritional needs. So the complementary feed, the phase, which ranges from the 6 months and it continues to the 24 months of the age, is highly crucial since many infants begin to suffer the malnutrition. Now, when it comes to the practicing the complementary feeding, it reflects or it is relied on the principles, certain principles, which you all can see in the slide. F stands for the frequency of the feeding. That means right from the 6 to 8 months, the breastfeeding along with the 3 meals per day. Likewise with the age wise. Then comes the amount of the feeding, which should increase with the age. Thickness of the food, in other terms, it is also called as the consistency. Variety in the food in terms of the food sources. Active feeding or responsive feeding, which is like how the baby is responding towards the food when food intake, and the most important, the hygiene part. Now, if you can see in this slide, it's mentioned about what should be the recommended food texture and the frequency in the amount as per the age. Right from that 6 months, the texture should be like very thick porridge, well mashed foods, and continue with the mashed family foods also. Use only treated water to prepare foods. The frequency should be like with the continuous breastfeeding, 2 to 3 meals per day, and the amount should be starting with a 2 to 3 tablespoons per feed, increase gradually to half of a 250 ml cup. Likewise, for the 9 to 11 months, gradually the amount starts increasing. like finely chopped or mashed foods and the foods baby can pick up with his or her fingers. The frequency should be the 3 to 4 meals per day with frequent breastfeeding. Followed by the 12 to 23 months, the family foods, chopped or mashed if necessary. Wash children's hand before they feed themselves, because by the time baby can actually try itself to feed itself. Followed by the 3 to 4 meals per day plus frequent breastfeeding. And based on the child's appetite, 1 to 2 snacks may be offered. And then by this age, the amount of the food is also increased to 3, 4 to 1 to 50 ml of a cup. Now, another very important aspect is that which comes with the complementary feeding is the wash integration. And several studies like as seen in the Bangladesh and the Zimbabwe, it has shown that the promotion of the infant and child practices is associated with the earlier introduction of the nutrient-dense complementary foods and a greater likelihood of meeting the minimum dietary diversity and also minimum acceptable diet scores. So the WASH, which stands for the water, sanitation, along with and the hygiene, that is very important along with the nutrition interventions. And this should not be compromised because it's very important. Otherwise, the source of infection starts from there. And as you can see in the slide, it is mentioning the different steps of washing your hands. This again should never be compromised. So with this, I would like to conclude that if we want to promote a complementary feeding in a successful way and avoid the failure to thrive, both principles along with the wash integration should be joined together to reduce the environment enteric dysfunction along with the better nutrient availability and bioavailability as well as to make sure to improve the growth and development. Like in the slide, it's showing that the child is requesting to his parents that nutrition in early life is very crucial for his brain development and physical growth. So feed me properly as per these days. Thank you so much.
Thank you, Jyoti. Any queries from ma'am?
Thank you, Jyoti, for your excellent presentation. I have a question like complementary feeding is essential for baby, and along with the complementary feeding, how long the breastfeeding should be continued?
Ma'am, breastfeeding actually should be continued at least 2 years. And if, at least for till 2 years, it is essential along with the complementary feeding.
Okay. If someone continue more than 2 years, is there any beneficial effect or no other extra effect?
Ma'am, if there is any like the mother is continuously breastfeeding, then it has to be also make sure that the baby is also eating the family foods as well. There is nothing like a negative effect on that. Breastfeeding is anyhow is very good, but again the mother might get deprived of the nutrients if this feeding gets continued for a longer period of time again. So she has to be again dependent on the diet properly.
Okay. Thank you so much.
Thank you.
Yeah, thank you so much. So we have come to the end of our presentation. Everyone have presented. There are 6 participants for this competition: Priyanka, Pallavi, Titi, Oshmita, Shiranjana, and Jyoti. So we are taking 2 minutes for the result announcement. And in this 2 minutes, I just want to share that the awards there already we have given in Facebook, WhatsApp, everywhere, that in every occasion celebrated by the FSTN Exploration Foundation, we recognize some young researchers, some young dietitian for their fruitful contribution in the Society of Health and Nutrition, and we recognize them with the Excellence Award from the FSTN Exploration Foundation. And here also in this occasion, we have a lot of CVs are being there. So some CVs are rejected and some CVs are accepted, and among them
the jury decision has come that there are two awards for this ceremony. So I would like to present their names. So here the Young Dietitian Award 2023 is going to Ms. Shawni Shah, pursuing PhD from the Department of Food and Nutrition, West Bengal State University, India. Shawni, are you there?
Yes, ma'am.
Okay. So Shawni is basically, please don't say ma'am, because Shawni is basically my friend, my colleague, basically my college friend. So this is also a very delightful moment to share the screen with her, and she is very talented till from the college days, and this is also she has done a lot of things in her career. So congratulations, Ms. Shawni, for receiving this Young Dietitian Award 2023 from the FSTN Inspiration Foundation. I would request everyone to please unmute your mic and give a round of applause for Shawni. Thank you. Thank you so much, everyone.
Thank you, FSTN, for selecting me, and thank you, everyone, for appreciating me. And I would like to do more contribution for the society, and will be very happy if some of my effort or some of my contribution can do some better for our community people. Thank you, everyone.
Yeah, thank you, Shani. So coming to the next one, Ms. Shreyashi Shaha, nutritionist, and also she has a specialization in renal diet and nutrition. She has received this award for her fruitful contribution in the genre of food and nutrition. So, Ms. Shreyashi, are you there?
Yes, ma'am.
Yeah. So, Shreyashi, congratulations for receiving this Young Dietitian Award 2023 from FSTN Exploration Foundation, and we are looking forward that you will do a lot of things in future for the well-being of the society. So, congratulations, Shreyashi, and I will request everyone to give a round of applause for her. Thank you so much. Our certificate will be given within 7 days. Okay, so thank you so much, everyone. I think the results have come to the point. So I would just request, just a minute I will take to announce the result. Okay, then we have come to a conclusion. There is a very tough competition between all of them. All of them have done lot. They have done very well, and among them there is a tough competition between 2 or 3. And among them, the ma'am has decided to give this award for the best presentation in 5 in 5, that is 2 Pallavi Chatterjee. Pallavi, are you there?
Yes, ma'am. Thank you, ma'am.
Pallavi Chatterjee. She is a consultant dietitian now, and she has been associated with Fearless and Apollo, I think. And she is a very bright student. I know her from a long years ago. So she is a very bright student, and the ma'am has also said that. Yeah. And certificate will be given to you all, and Pallavi will get your certificate and the token of cash prize for this for this award. You will get a token of appreciation from the FSTN Exploration Foundation, and get that within 7 days. Congratulations, Pallavi.
Thank you, ma'am. Thank you, ma'am.
Congratulations.
Thank you, ma'am, for selecting me.
So I would request everyone to again give a round of applause for the winner of this 5 in 5 presentation, Pallavi. Very, very much congratulations to you all. So another thing I want to share that all the presenters, those who have presented here, will get the certificate for the presentation, and others who are only participate in that, so they will also get the certificate for the participation of. So we have come to an end, and thank you so much. We are very, very delighted to have Rejina Afrin from Bangladesh, and we are very much pleased that ma'am have given us so much of time for the presentation as well as for the judgment. She is so kind of that, and thank you so much, ma'am, for being with us for all the time.
Thank you so much, Ishani, and it was very delightful for me if I can be there. And last time I enjoyed the company of Sankishami Vivekananda University, so this is a great prevalence for me. Thank you so much.
Thank you so much, ma'am, and we are looking forward that we will have more session with us in the FSTN. Yeah, thank you.
Thank you.
So we have come to an end. So you all will get your certificates within 7 days, as well as the presenter will get the certificate. So thank you so much, everyone, and have a good weekend, and good night to all of you. Have a nice Sunday, everyone, and hope we will meet again in any other program. And I request everyone to join the official group of FSTN Expression Foundation to get the. Thank you so much, ma'am. Again,
thank you so much. Good night.
All the members of FSTN Expression Foundation, and thank you, students, for making this program so successful. Thank you so much. Good night.
Good night.